Yes, namaste. Welcome everyone for today's webinar on healthy aging, managing chronic conditions. We have Dr. Mark Halpern. Amazing to have him today, and Dr. Mahadev and Sitaraman. And we're going to talk about age, right? Maintaining health, how vitality becomes both more important and it becomes more achievable when we understand the body's natural rhythms and needs. And so we're going to have a great conversation between Mahaji and Dr. Mark as we explore the timeless wisdom of Ayurveda, how it offers so many tools, and how HUA and CCA together are developing programs and retreats and other ways that will help you strengthen your resilience and together bringing balance using Ayurvedic principles. So with that little background, please do put in the chat where you're zooming in from. Give you a shout out. By the way, I'm Ankur Patel, Director of Outreach, joining from rainy Los Angeles today. And we have Dr. Mark Halpern. He's a doctor of chiropractic. He's got his MAS in Ayurvedacharya. He has played an important role in the development of Ayurvedic medicine in the West, from founding the California College of Ayurveda over the last 30 years. He has done so much and is considered to be a preeminent practitioner and teacher of Ayurveda in the United States. He's brought so many people along with him, and I'm glad that we have joined paths going forward as HUA and CCA. And we've got a lot of new programs and new things to offer, and that's why this webinar is going to be so exciting. And then, of course, we have Dr. Mahadev and Sitaraman. Mahaji is the Dean of the CCA. He's also Ayurveda faculty at HUA. He holds a PhD in medicinal chemistry. He brings over 20 years leadership in Ayurveda and integrative health, and it's been my pleasure to work with him on so many different facets, from in-person events and conferences to workshops to developing new courses, and of course, this amazing partnership with the California College of Ayurveda that is just the beginning of so much more that we will be doing. Vivek ji from Arizona, Vrushti ji from Phoenix, glad to have both of you with us today. Mitten ji from Houston, and who's this? Somebody else from Seattle. Let me see if I can pull that name up. And Richa G from Bay Area, a student of the Principles of Ayurvedic Medicine. What a great, glad to have you here with us today. So with that, let me hand it over to Maji. I think we're going to get into a conversation. Maji has some framing questions, and always, Dr. Mark, it's a pleasure to hear from you. Looking forward to today's webinar. Thank you.
Sure. Thank you. Thank you, Ankurji. Namaste, everybody, and great to be here. Let me quickly share my screen to set the context for today's conversation, right? So I hope you're able to see my screen. So today, if you look at chronic diseases in America, okay, chronic diseases, what are chronic diseases, right? These are diseases that are like long lasting. They, uh, progress slowly and they persist over a period of time, okay? And these are the leading causes of death and disability in this country. In fact, it says 3.8 trillion in annual healthcare costs. This was about a year back when I started researching. I think by now it's already 4.3 trillion or something. So this number is continuously increasing. And this is the biggest burden today. And if, in fact, if many of you noted recently that there was a conversation around people who have chronic diseases, they're not going to be getting visas to come to the US. There was a lot of conversation about it last week. And so 6 in 10 adults in the US have a chronic disease, and 4 out of 10 have 2 or more. Okay. And so if you actually look at this a little bit more details, a lot of South Asians think, oh, this is in America. It has nothing to do with me, right? A lot of people think, oh, it's not me. But if you look at the data, there's a study called Masala study, which says the Masala stands for mediators of atherosclerosis in South Asians living in America. Okay. If you look at the study, it says South Asians have higher rates of heart attack and stroke that is not explained by widely known risk factors like blood pressure, diabetes, or smoking. Okay. So South Asians are impacted by this even more. And if you look at the quickly patterns of disease. So 100 years back to now, in the 100 years, the disease pattern has changed, right, to more of chronic conditions. So clearly, there is a focus on diet and lifestyle, prevention, promotion of health. Everybody's talking about it, right? See, we cannot be treating these diseases. We are spending more money. We are not able to treat. We are only managing the symptoms, and it's not reversing, right? So this is where we believe Ayurveda has a big role to play. And I'm so happy to have a conversation with Dr. Mark Halpern on this. Dr. Mark, welcome.
Thank you so much for inviting me to be here with all of you today, and I'm excited to share a bit of the wisdom of Ayurvedic knowledge with all of you, so that we can really all have what we want, which is health and well-being. This is so very important. I've traveled all around the world, and the two things that people want is to feel good and to have peace of mind. And Ayurveda is really an incredible path to accomplishing both of those goals, to keep you healthy at any stage of your life, but particularly as we start looking at getting older and the decades from which we may have been living in harmony or out of harmony, we begin to see the impact of how we've lived on how we feel as we get older. So today, I'm sure we'll be getting into that in more detail and exploring all of these concepts so that hopefully you can improve your life.
Wonderful, wonderful. So I'm going to be asking Dr. Mark a series of questions, which probably will help guide you through this learning. And if you have any questions, please post them, and I'm happy to take them at the end. So we'll spend the next 30 minutes or so talking about various things. So let's start with Ayurveda's emphasis on early detection of imbalance that help prevent chronic diseases before they actually fully manifest. So basically, the diseases, before they manifest, there are early signs and things that happen that usually we don't notice, right? And we only know when we kind of go over the tipping point and you see symptoms. So how can Ayurveda help, and what do we look for?
Yeah, thank you. That's a very good question. So, in Ayurveda, we understand that disease has certain roots in the body. And before a disease fully manifests throughout your body, let's say Alzheimer's disease or heart disease, before that even happens, long before that happens, the roots of that condition are found in the digestive system. And so we say in Ayurveda that the disease in the physical body begins in the digestive system. It spreads out from there and enters into circulation, circulates around your body, and then the disease settles into the tissues that are the weakest in the body. Once it settles into those tissues, it continues to grow and expand in those tissues until those tissues are damaged. And the damaged tissue could be your heart, or it could be your brain, or it could be your liver. The roots of it all are in the digestive system. So one of the things that we look at for the early manifestations of an imbalance in your body is the health of your digestive system. I guess you could say, in many ways in Ayurveda, this is the most important system of your body. And even now in Western medicine, they're starting to come to that same understanding, taking a look at what's called the microbiome of the body, or the balance of bacteria and fungi and the other microorganisms that live inside your digestive system, play a very vital role to your entire health and well-being, really, of every system of your body. Ayurveda has known that for thousands of years, and has been addressing that for thousands of years through proper diet and proper lifestyle, a diet and a lifestyle that matches your uniqueness, your constitution, as well as the nature of any imbalances that are identified by your Ayurvedic practitioner. So it really begins by understanding what's happening in your digestive system. If you're having gas or bloating, if you're having burning indigestion, if you're having cramping in your digestive system, if your digestion just feels heavy and sluggish, or maybe your elimination is not quite right, and you're having diarrhea or constipation, these are the earliest signs in your body that the seeds are starting to sprout in your digestive system. If it's not manifested properly, if it's not managed properly, then the disturbance, which we would say it's a disturbance in the doshas, the physiological forces of the body, become imbalanced.
Is that Dr. Mark who cut out?
Yeah, I think so. I was checking my
Yeah, me
connection to
too.
see if it was me.
All right, all
Dr.
right.
Mark is frozen. Okay, let me try calling him or messaging him.
Yeah, yeah. Please put in the chat. Yeah, sorry about that, folks. We're back on it. Please, Sucharita ji from Richland, Washington. Thank you for joining. Dilip ji from Maryland. Um, Thank you for joining today's webinar. Just having little technical difficulties. Garima ji from Los Angeles. Thank you for joining. It was Vrushti ji from Phoenix. Yes, yes. And we got Dr. Mark back. Yes, just a little internet difficulty. No big deal. I've got another little poll up. How did you find out about this webinar? If you let us know, and we'll get back into it. Sorry about that, Dr. Mark.
Yeah, Dr. Mark is back. And you were talking about the digestive system and how there are early signs. Please continue.
Okay, very good. So the earliest signs of the imbalance are in your digestive system. It spreads from there into circulation and then into the weakest tissues of your body. And so if we can focus attention initially on your digestive system at any age, then we're going to be able to prevent the physiological disturbance, which we define in terms of the doshas, from spreading from your digestive system into circulation and then settling into the tissues of your body, whether it's your heart, your lungs, your brain, all the sites of your body where we tend to have chronic disease. So if we trace the chronic disease back, we will see that there's a disturbance in the circulatory system and also in the digestive system. So this is really the key, and that's why we focus so much attention on proper diet, on how we eat our food, as well as what we eat, and a proper life, which is our lifestyle, so that our digestion is optimal. If physiology is optimum in your digestive system, and Western medicine is proving this as well, if physiology is optimum in your digestive system, then the other systems of your body are going to function more optimally and be able to prevent disease. We could even say that your immune system depends upon your digestive system for its own stability. And this is really the role of Ayurvedic medicine.
Wonderful. In fact, I was going to ask you next about, sleep, right? If you actually wake up in the middle of the night, it's probably because of some imbalance in your system. And so sleep is another thing. And to segue into the next question, it is, how does your daily routine also impact all these things, right? Your daily routine, your lifestyle, diet on a day-to-day basis, how do they impact these imbalances?
Yeah, when we talk about lifestyle, we're really talking about the style of your life from the moment you wake up until the moment you go to bed. And then that's going to be impacting what happens after you go to bed and how well you sleep. And so your lifestyle is really very important. You might ask yourself, what is my lifestyle like? What's it like? What happens when I get up in the morning? What do I do? For so many people, particularly people in their 30s, 40s, and 50s that are engaged in full-time work and working very hard, they jump out of bed and they're trying to hurry and they're trying to get ready to go. They're thinking in their mind of all the things they have to do for the day. They're thinking about the traffic they might meet on their way to work, and they're already stressed and they're moving very, very quickly. For so many people, by moving quickly, they don't even take time to eat a proper breakfast. And so they may stop at fast food place on the way to work. That may be their lifestyle. Or maybe it's grabbing something out of the refrigerator, bringing it in the car, and eating in the car on the way to work. That's their lifestyle. Then when they're at work, what's your lifestyle? When you're at work, are you sitting down? Are you standing up? Do you get up to walk around very much? Are you very stressed? What happens at lunchtime? What's your lifestyle at lunch like? Are you taking the time to sit down and eat your food calmly, quietly, so that you can digest your food properly? Remember, we're trying to normalize the functioning of your digestive system. If you are stressed and if you are hurried and you're not taking the proper time for your life, you're going to see the problem first in your digestive system. So when we talk about lifestyle, we talk about what is your morning routine like? What is your work routine like? What's your evening routine like? And are they healthy routines? We can certainly get into that in much more detail about what constitutes a healthy routine. But one of the simple things you can ask yourself is my routine calm? Is my routine calm? For most people, the answer is probably no. I'm doing this, I'm doing that, I'm running here, I'm running there, I'm engaged in so many things. And all of that tension, all of that hurrying is impacting every aspect of your physiology, not just your digestive system, because yeah, it's going to hurt the way you digest your food, of course. But your nervous system becomes impacted by that. Your sympathetic nervous system overreacts to the stresses of your life. And that starts causing hormonal imbalances. And that begins to disturb your physiology. The mind is producing neurochemicals as a result of your anxiety, your hurrying, your stress, your anger. And that's impacting the physiology throughout your body. So your lifestyle is really the foundation of your well-being. There's nothing more important if we were to look at lifestyle from what you do and how you do it, from the moment you wake up until the moment you go to bed. And you're either living harmoniously, you're living a harmonious lifestyle, or you're living a disharmonious lifestyle. I like to say that where there's harmony, there's health. Where there's disharmony, there is disease. And so it's all a matter of how you're choosing to live your lifestyle. And sometimes it doesn't feel like a choice. It rarely does. It feels like we have to do it a certain way. But it really is a choice every day and every moment, how we're going to live our lives. So healthy life requires a healthy lifestyle. And unhealthy life, unhealthy lifestyle. So each part of your day is equally important. Dr. Mahadevan, are you still there?
Can you hear me?
Yes, we just can't see you.
Oh, I don't know. One second. Sorry, something happened, popped up. That's why I asked, can you hear me? So wonderful. In fact, I was just thinking, if I were to write a book on modern dinacharya, right, today, I would say that, it's how long you scroll on social media reels, which is an indicator of imbalance in your life. A lot of people actually wake up and pick up the cell phone first, or they kind of scroll reels and look at things before going to sleep, right? That is a huge indicator of or a trigger for imbalance in your body. So not looking at screens first thing in the morning or the last thing before going to sleep is an important aspect today, because we are continuously plugged in and digital, right, in this day and age.
Ayurveda teaches that motion is one of the major factors in the cause of disease, cause of suffering, beginning in the digestive system and so on. So the faster we're moving, the faster our physiology is going to evolve in a manner that disturbs the tissues of the body and we get sick. So if we wake up in the morning and the first thing we're doing is engaging the world instantly, for some people even in bed, right? They just grab their phone and they say, well, before I get up, I'm going to look at my emails, I'm going to look at the news, I'm going to do all of these different things. Already we're engaging the motion of our bodies, the motion of the world. And all of that causes us to age more quickly. And so, there is ordinary aging, and there's extraordinary aging. Ordinary aging we can call kala jara. Kala jara means that you're aging in a harmonious way with life. Kala means time, and jara is aging. So we're aging according to our natural rhythm of time, and our motion is balanced. And, the earth moves around its axis and it moves around the sun. We age. But there's akala, meaning outside of time, jara, where we age inappropriately. And this is due to too much motion. And so all of this excessive movement in our lives causes us to age faster. And when we age faster, what that means is our tissues break down faster. Somebody when they're, 60 starts to break down like somebody who's 80. And so they're aging more quickly. And that can begin as soon as you wake up. If you're engaging the world so quickly and you're not taking any time for yourself and you're constantly busy, and you don't stop, you don't stop. Stopping is so important. Pausing. Akara, A-K-A-R-A, jara, J-A-R-A. Akala, A-K-A-L-A. I saw a question about spelling that. So anyway, if you are moving all the time, then you're going to age outside of time. And that means you will age more quickly. So slow down. If there's nothing else you get out of this program today, if you slow down, your physiology will begin to normalize. Normal physiology allows for healing to take place. Moving quickly interferes with the process of healing. So if you're suffering from anything, from heart disease to depression to osteoporosis, if you slow down, you're going to heal from those conditions. But if you don't slow down, you're not going to heal. It's just going to continue to progress more rapidly. It's not about the medicines, it's about the lifestyle. So many times the medicine is just to appease us so that we can continue our dysfunctional lifestyle. That's not a good idea. It's just not a good idea. If you had a broken ankle and they put you in a cast, would you put yourself in a cast and then go out jogging again while you're in a cast? No. You have to rest for the bone to heal. You have to rest to stay well and to heal from any condition. So slow down, stop for a moment. And then you can begin to engage a healthy morning routine, which a healthy morning routine might involve some time in front of an altar. It might involve some meditation, some yoga, some prayer, going for a walk, putting some oil on your body and doing some abhyanga, where you oil your body in the morning, taking good care of yourself, putting oil in your nose, oil in your ears, oil in your mouth, just taking care of yourself. Ayurveda teaches you how to take care of yourself, but the interesting thing is that it takes time. It takes time to take care of yourself. It takes time to take care of yourself. But if you don't do it, your body is going to break down. You're not going to be able to be of service to your family. You're not going to be able to be of service to your work. I was having this conversation with somebody the other day, and I was saying, they were saying, well, how? I don't have time to do that. I said, well, just imagine you were taking care of your car and you never stopped to put gas in it. And you said, I don't have time. I don't have time to stop at the gas station. Oh my gosh, I got to stop at the gas station? Really? And then you get out of the car and you just put the hose in. You got to sit there and wait for it to fill up. You just got to sit there. Man, I could be doing so many other things right now. I just got to sit there and do nothing. But that's what you have to do to yourself. Because if you run out of gas, and you will, your car is going to break, your body is going to break down. And you're not going to be able to go to work. You're not going to be able to take care of your kids. You're not going to be able to take care of your parents because you haven't taken care of yourself. So it's very, very important to slow down, to stop, to refuel properly, taking care of
Sure.
yourself.
Wonderful. In fact, a lot of questions are coming in, but we'll get to the questions in the end. And somebody did comment that, oh my God, doctor, you're right. That's exactly me. And I'm sure most of the people on the webinar are thinking, oh my God, that's me. We need to learn to slow down. And you also answered one of my another question that I was going to ask about, the morning routines and things like that. Before that, you mentioned fuel for the car, right? So diet and nutrition is very important, and there's a concept of Agni and your digestive fire, and what role that plays in chronic diseases, and how does good nutrition support metabolic health and management of these chronic conditions?
Yeah, good nutrition begins from the moment a child is born. If you want to avoid chronic disease, it begins by taking care of babies properly. Nursing instead of formula. The nursing mom having a healthy diet is extremely important so that the child gets off on the right foot. In traditional Ayurveda, there's a whole practice that both mom and dad actually go through before they conceive a child to make sure the child has a healthy start, purifying their bodies and nourishing themselves properly. Then when the child is born, beginning to take care of the child properly, oiling the body, nourishing mom so that mom is able to better take care of the child with nursing. And it goes on all through your life. If you take care of yourself through your life, of course, you will avoid those chronic diseases that people get as they get older. The chronic diseases usually tend to be disease of the heart, disease of the nervous system, disease of the lungs. These are the three major ones that, tend to cause harm to people, as well as cancers throughout the body. You can avoid most of that, reduce it down dramatically if you begin with a proper diet early on and then continue through your life. Now, if you haven't done that, and most people haven't, so you get to be 50, 60, 70 years old, and now the body is breaking down. And now there are chronic diseases. There's diabetes, there may be dementia, there may be heart disease, there might be osteoporosis and so forth, these chronic now diseases that are impacting our lives. So if you start now with a healthy diet and a healthier lifestyle, then your physiology can normalize. And if it normalizes, then your body has the best ability to heal itself. So some very simple things that you can even begin to do now before you even get into the Ayurvedic nuances of your diet is begin to have whole food rather than processed food. Just think of it that way. Whole food rather than highly processed food. Whole food means it kind of looks like it grew out of the ground. Whole food is not something that, like if you look at a corn chip, it doesn't look like corn to me, right? And so it's highly processed. Eat whole foods, fresh foods, vegetables, whole grains, as close to nature as you can, and make sure that it's organic. That's also really important. And the last thing is eat only till you're 3/4 full. Reduce the quantity of food. In Ayurveda, we say the proper quantity is that which will fill up your hands for a meal, right here. So whatever you put in your hands, that's going to be the amount of food that you need to eat for that meal. The bottom line is that most people overeat too much. And that's why we have such an obesity problem in this country. 2/3 of Americans are overweight or obese in the United States. 2/3. Only 1/3 are at a healthy weight. That's just remarkable. And so it's a combination of learning to eat proper foods and also reducing the quantity of food. And if you reduce that and you choose whole foods, then you are, and they're organic, you're really on your way already to normalizing your food program. But then Ayurveda helps you to get even more specific and say, well, how can I use food as a medicine to normalize my physiology? And that's when you really get into the appropriate diet for you. It's not the appropriate diet for me. You may thrive on spicy food. I may not. It may give me burning indigestion. That's okay. For you, that's what you need to normalize your physiology. And for me, if I have spicy food, it's going to disturb my physiology. Same thing could be said with oily food or not so oily food. Nothing is right for everyone. Everything is right for someone. Ayurveda is really a path of understanding what's going to be right for you. So if you get an Ayurvedic consultation, figure out the nature of your constitution and the nature of any imbalances you have, then food can be used as a medicine to restore your physiology. And that's when we get into the Ayurvedic diet as well. So proper diet and a proper lifestyle are going to be essential for restoring your well-being if you're already suffering from a chronic disease.
Wonderful. I think you've talked about lifestyle and diet. I mean, the next thing comes to mind is mind-body practices, right? And a little bit about even sleep or pranayama, meditation, say yoga nidra, asanas. How do they help incorporating them in your day-to-day life?
It helps in several ways. It's not just one way. So one way we've already talked about, if you're going to practice yoga, meditation, pranayama, you've already slowed down. You've already taken some time for yourself. So congratulations for those of you that are doing that. If you're doing that every day, you've already just receiving the benefits of slowing down. And slowing down slows down the aging process of the body and of the mind and of the nervous system. So you're already scoring points. Now, what else does all of that do? Well, Ayurveda says that it's not just slowing down the body and being less busy during the day that's important, but it's also slowing down the thought processes of the mind that are going to slow down the aging and deterioration process. And so if you're practicing meditation successfully and pranayama successfully, the mind is calming down. The vittis, the disturbances of the mind, are calming down. And when that happens, time slows down. Stress is reduced. And all of that is supporting your healing. You know, there are studies right now that are very, very clear that show that the stress you feel is actually accelerating all the diseases of your body, even something like osteoporosis, which you might not associate with stress. Now, osteoporosis, that's because I'm getting older, right? Osteoporosis, that's because my hormones are getting changed, right? Especially if I'm a woman, then I'm not making as much estrogen and I'm more prone to osteoporosis. Men can get it as well. But what they've shown is no matter whether you're a man or a woman, if you are stressed, then that stress accelerates bone loss. It accelerates bone loss. That's amazing. So it's not just about diet and exercise to prevent osteoporosis, which is a chronic disease. It's about reducing stress. So meditation, yoga, pranayama, you've already taken time to slow down. You're gaining the benefits now, quieting the mind, which also reduces your anxiety and your depression. And it's changing your physiology so that you slow down the deterioration in terms of the muscles as you get older, the bones. You know, muscles begin to atrophy as you get older, bones begin to become more porous as you get older, osteoporosis. And the heart begins to become weaker. It's a muscle, it becomes weaker. All of that is accelerated when you're under stress. So I recommend for people to practice my favorite technique, which is yoga nidra. Yoga nidra is a beautiful practice where if you're not really well trained in meditation, which is also a beautiful practice, mantra meditation, beautiful practice. But yoga nidra is really special. In Yoga Nidra, you can do that practice laying down, and it's a guided meditation. And it takes you through your entire body, relaxing your body, slowing down your body, really focusing on where you're holding tension in your body and learning to release it. I made a recording which you can download from iTunes or Amazon, an MP3. And you can buy the recording as well through the Shanti Shop, which is the college's boutique store online. Many products are there. But it's called Yoga Nidra and Self-Healing. And if you do this practice, Yoga Nidra and Self-Healing, it's not only going to relax you and slow you down, but you're going to learn how to use your mind to be able to impact your physiology and accelerate your healing, not just slow down your dissolution or your disease's progression, but actually reverse it through Yoga Nidra. And that's the incredible thing about Yoga Nidra. It'll allow you to reverse the stresses that are present in your life right now. So there's really so many benefits to meditation, pranayama, Yoga Nidra. And we can even get into it in more detail too. We can't do it all here today, but there's different physiological impacts that practices like alternate nostril breathing have versus lunar breathing in through your left and out through your right, solar breathing in through your right and out through your left, Kapalabhati, where you do another practice that cleanses your lungs and it stimulates your nervous system, your brain. So there's specific practices your Ayurvedic practitioner can work with you on, depending upon what's going on with you, so that they can specifically put together a plan to meet your goals. That's really the most important thing. So there's lifestyle, and then there's very specific practices for healing purposes.
Okay. In fact, Dr. Mark, interestingly, you're talking about focusing on diet and eating mindfully and then slowing down, doing yoga and yoga nidra. You're giving a lot of recommendations. And most common thing that I get is they're all very difficult to incorporate and follow in life. And the question I get asked next is, are there any herbs or supplements or any shortcut? Anything can I take which will help improve my health and slow down the aging? Everybody wants, it's easy to pop a pill than to spend an hour doing yogasana, right? So are there any herbs or rasayanas or therapies that you would recommend that's easier to follow?
Yeah, I'll address the herbs in just one moment, but I do want to say something. The most difficult thing that we do is try to change our patterns.
Right.
It's the most difficult thing that we do. We get into a pattern, and it's as if we are addicted to that routine, addicted to that pattern in our lives. And it's hard to make that change. And we need support to be successful making the change. One of the beautiful things about the way Ayurvedic practitioners are trained at the California College of Ayurveda is that they're trained not just to tell you what to do. They're trained to support you to be successful doing it. And that's one of the things that really makes the training here in the United States unique and different, actually, than it is practiced in India. When Ayurveda first came to America and the first Ayurvedic doctors came to the United States, they go around, do consultations, and give a long list of things for people to do. And people wouldn't do it. People wouldn't do it. And so they thought, oh, this is amazing, but it's not really very practical. When we started the California College of Ayurveda and I started training practitioners, I said, the best practitioners are not going to be the ones who know the most. The best practitioners are going to be the ones who are best able to support their patients to implement the Ayurveda into their lives. So the training at the California College of Ayurveda includes a tremendous amount of training in counseling. So we counsel our patients. We work with them on a regular basis to transform their lifestyle, in addition to giving them medicines, because medicines, while they're helpful, they can only do so much if your lifestyle is unhealthy. And so we must be successful. So we work with our patients very slowly over time to implement Ayurveda into their lives. Most of the patients I've worked with, I tell them at the beginning, I'm going to be working with you for 6 to 12 months. 6 to 12 months. And we're going to transform your lifestyle, and we're going to transform your life. We're going to transform your health and your well-being. I'm going to set you on a new course, but it's not going to happen with one visit or two visits. It's going to happen with ongoing care. So we see our patients on a weekly basis to begin with. And then we moved every 2 weeks as Ayurveda is being more successfully implemented. Then every month as Ayurveda is being more successfully implemented. And so it takes time to make that lifestyle change. But you know what? If you do it, I guarantee you, you're going to change the course of your life, which is really the promise of Ayurveda. Mm-hmm. Now, there are medicines that can enhance the work that we do. Of course there is. And Ayurvedic medicines are very powerful. Herbs are very powerful. And one group of those herbs are called rasayanas. And rasayanas are herbs that, it's called if you translate rasayana, it means the path of juice, rasa. And so what it does is it makes your body juicy, which is young, which is vibrant. That's what rasayanas do. And practically speaking, they slow down the aging process, and they sometimes reverse it. Although to be a true rasayana, you have to first purify your body and get rid of the toxins that are in your body. And then you take these medicines, and then these medicines are going to rejuvenate you. So another common translation of rasayana is a rejuvenative. And so it's the path of making us young again, juicy again. So yes, there are some wonderful ones. The very famous one is most famous is Chyavanprash. Chyavanprash is a jam that is made from the fruit of amalaki, and then it's cooked with about 55 different herbs in it, and some ghee and some honey. It's made into a beautiful jam, and it tastes wonderful, and it's great and the spices in there. It's great for rejuvenating your body. The challenge again is if your body is toxic, you're not going to get the benefits from it. So you really need to purify your body first to gain the benefits. And in fact, if you don't, and your Agni is low, your digestion is weak, you can actually produce more toxins from all of these rasayanas. That includes other rasayana herbs like ashwagandha, shatavari, tapikachu, and so many other herbs that have so much potential for rejuvenating our bodies, but we also have to have a pure body for that to occur. And that's where our diet and our lifestyle in general come in. If our diet and lifestyle are healthy, then we're not going to have as many toxins in our bodies, and we're able to really benefit from these rasayana herbs. So these herbs are very, very powerful. And there are specific rasayanas, by the way, for different tissues of the body. So there are some rasayanas, for instance, that are really beneficial to the nervous system and the brain, like Brahmi, which is Bacopa moniera. It's a wonderful rasayana for the brain and for your nervous system. There's other ones that are excellent for your lungs. I use it with lung cancer patients, in fact. Ashwagandha, wonderful rasayana for the lungs. Really, every tissue of the body has its own rasayanas. So this is something that your Ayurvedic practitioner can work with you on, choosing the rasayana that's going to target the tissue of your body that's chronically ill. Then when you combine taking that rasayana with the proper program, that's really what's going to benefit you. That's what's going to lead you out of the hole you're in, heal your chronic condition, revitalize your body, and get you back to living the life you want to live.
Wonderful, wonderful. And as a follow-up to this is what I'm always asked, right? So I'm already seeing a modern medicine doctor. I'm already taking medications, and I'm also on some diet that they have prescribed. And so how is it now? What happens now if I see an Ayurvedic practitioner? How can I take herbs and this together, and how is this managed? And also, how do I, if I start getting better also, right? Can I stop the medicines? These are the questions people usually come up with.
Yeah, these are very important questions. Well, the first thing is you've got to work with a well-trained Ayurvedic practitioner. At the California College of Ayurveda, the medical Ayurvedic specialists are the highest level of training to understand both what's happening for you with your Western medical diagnosis, your laboratory results, and how the herbs are going to interact with the drugs. I mean, it's just a higher level than giving general lifestyle recommendations to people or telling people, go ahead and take this medicine or that medicine. Never should be done that way for people who are taking Western pharmacological drugs. So it needs to be managed very carefully. It needs to be managed responsibly by a professional healthcare provider. And a good Ayurvedic practitioner who's well trained is a professional provider of outstanding care and can work alongside your medical doctor, with your medical doctor, and understand your medical treatment so that you can get the best care that is possible. So first of all, let me say that the Ayurvedic diet and lifestyle will certainly complement any allopathic Western treatment that you're already receiving. So if you were just to incorporate lifestyle changes, you would even get better results with your pharmacological medicine, the approach that you're on, maybe right now, if you're, let's say, treating diabetes or treating heart disease. So no problem there at all. Now, if you're taking Ayurvedic herbal medicines, they can interact with your drugs. So it's very important to know the nature of those interactions and to go to a highly trained, responsible practitioner. Now, the next thing is that once you're getting better, your highly trained Ayurvedic practitioner is not able in the United States legally to tell you to stop taking your drugs. That's very important for you to know. They can't wean you off your drugs. They can't tell you not to take your drugs. What they can do is work closely with your medical doctor. And so either they will contact your medical doctor or you will contact your medical doctor and you'll say, I've been doing this, this, and this for a long time. I want to be retested to see if I can lower my dose of medicine depending upon the condition that I have. Then you lower the dose of the medication until eventually you're off the medication. It's a little different management if you're talking about dealing with drugs that you're taking for depression versus drugs that you're taking for hypertension or diabetes. So it's a combination of working together. Your Ayurvedic practitioner in the United States must work closely with your medical doctor because in the United States, Ayurvedic doctors are not able to alter your pharmacological medicines. That's very important for you to know.
Okay, wonderful. In fact, I just thought I'll share my screen for a second. So this is what Dr. Mark is talking about, clinical consultations at CCA. So we have a page and we have all of our practitioners listed here, and you can actually fill a form and we can do in-person or online consultation, and somebody will reach out to you and set up a time where you can do one-on-one consult with one of our experienced team. So, Dr. Mark, if somebody comes in and sets up an appointment to see one of our practitioners, what can they expect? How long will it take? What do they need to share information on? How does an Ayurvedic consultation work?
Yeah, you're going to get, if you come and you see one of the really well-trained practitioners, you're going to get the most elaborate consultation you've probably ever had. And I say that because it's very different than simply taking somebody's pulse and then telling them what's going on. Pulse diagnosis is a part of the examination treatment, but in traditional Ayurveda, classical Ayurveda, which is not always practiced even in India, it's a thorough evaluation looking at body structure, body function as well. It's 2 hours to look at the entire body. The structure, the physiological functioning, and to do a proper consultation to understand your lifestyle. What goes on from the moment you wake up to the moment you go to bed? What challenges are you experiencing as well with your health? What drugs are you taking? So all of this comes up in the initial consultation, which takes about 2 hours. After that initial consultation, your practitioner puts together a complete treatment plan in order to support you. What is that going to look like? It's going to incorporate diet. It's going to incorporate lifestyle. It's going to incorporate herbalism. We have a pharmacy at the California College of Ayurveda with nearly 200 raw materials. And at the pharmacy, we put together the unique herbs that are going to support you. So you're going to be receiving personally designed formulations to rebalance your body. Sometimes that's mixed with classical formulations. Sometimes it's mixed with formulations that are more standardized for the digestive system. But for your specific condition, you can expect to receive a personalized formulation. It's going to be handmade at the clinic, and then it's going to be shipped out to you. So this is all very, very powerful in terms of the care that you receive. So 2-hour initial consultation, then it's going to take about 1 hour to go through the report of findings with you, where you're going to be educated as to what your constitution is, what the nature of the disturbances, what the plan is to help you to get back into balance, how that plan is going to be implemented over time, and what herbs you're going to take and why. And then you'll have follow-up visits, and the follow-up visits are to monitor you, to monitor how you're doing implementing the first recommendations into your life, when we can add additional recommendations into your plan. So it's all about the support that I talked about before. Again, the best Ayurvedic practitioner is not the one that knows the most. It's the one that is best able to support you to implement Ayurveda into your lifestyle. That's most important. Of course, all of our practitioners are very, very, very well trained.
Wonderful, wonderful. In fact, apart from the Ayurveda botanicals line of products that we have, don't we actually do custom herb formulations for every client or patient that we talk to, right? That's really unique in this time and age, because even in India, they don't do that, right?
Yeah. Well, when I was in India, I had this wonderful opportunity when I first got there. First time I was traveling through India, I was on a beautiful tour, if you will, meeting various Ayurvedic doctors all over India. And went to see one in the countryside in Gujarat. And he just had this house in the countryside, and I sat with him, and we spent time together, and he showed me his herbal gardens, and he showed me his office, and we spent time together. I went to temple with him. We had a really nice relationship, and he would make every medicine for every patient out of his garden. I mean, he just took care of his very, very small local rural community. And that really inspired me. And when I saw that, I said, we have to have an herbal pharmacy. We have to make these medicines individually to meet the needs of each person to practice Ayurveda authentically. So we have the IBO products, which is our product line, and many of those formulas I've designed, and they're excellent for working with the roots of the condition in the digestive system and working with the subtle roots within the mind. And then, yes, we really custom formulate for each patient right out of our pharmacy to meet the needs of each person's disease, because no two people are alike. We can come up with a formula and say, well, this helps heart disease, but no two people have the same kind of heart disease. No two people's situation is exactly the same. So really the best medicine is the one that's going to be prepared specifically and uniquely for your body.
Okay, wonderful. So maybe I'll spend the next 10 minutes in asking some of the questions. And see, we will not go into any specific question on anybody's specific health. I will only pick up some of the generic ones, which might actually apply to a lot of people. But one thing here I found very interesting from Jayanti. How does the slow down recommendation work in the context of going for morning runs? I've been a runner all my life, and does running support this, or how does running fit into that theory?
Did you say the context of what? And say that again.
Slowing down in the life, right?
Oh,
so
in the context of
you said
exercise?
Slow down. It's slow down in your life, right?
Yes.
So is it okay? Should I be running long distances, short distances, running okay?
Yeah.
How does it fit in?
So exercise, we didn't talk much about exercise. Exercise is very important. It's a very important part of your lifestyle. And everybody should exercise. And some exercises are healthier for you than others. Some exercises are better for one person, and for somebody else, a different exercise is better. So we think about running and we think, wow, running, that must be excellent for everybody. But it's not excellent for everybody. For some people, too much motion is going to cause damage to the joints of the body, the knees, the hips, the back, especially over time. And so an appropriate amount of exercise is going to be very important. And so your Ayurvedic practitioner can help determine what is the appropriate amount of exercise depending upon what the goals are that we're trying to achieve. Now, exercise is a time period during the day where you're choosing very specifically to be moving and to move in a certain way. But that needs to be balanced with time during the day to stop, to slow down. So for instance, if I am getting up in the morning and doing my meditation and I'm slowing down, not scrolling on the phone, I'm doing some prayer, I'm doing some meditation, I'm doing all of those things that we talk about in Ayurveda and in yoga. And now I want to do, maybe for me, for my body, this is going to be an important part, is to run. Then maybe I'm going to spend a specific amount of time in the afternoon and maybe go for a run in the afternoon. How far should I run? This is very important because that could be different for different people. And for some, it may be better to walk than it is to run, depending upon your nature, your constitution, the nature of the imbalance. So I think of running as a medicine. I don't think of it as a lifestyle. I think of running as a medicine, not as a lifestyle. As a medicine, it may be important for restoring balance to your body, but once you're back in balance, you may not need to run. It may be better to do a different kind of an exercise, because running over decades, it does age it ages the joints and it ages the tissues of the body. So balance is really what's ultimately going to give you the best results. Not too much, not too little, the right amount of exercise and the right kind of exercise.
Okay. There's a question around vitamin D saying most of us have vitamin D deficiency. What does Ayurveda suggest that we do about it? Anything from
Well, of course, Ayurveda does not directly address vitamins and minerals. Rather, Ayurveda addresses a proper diet. And Ayurveda addresses a proper diet in terms of normalizing your physiology. And so when your Ayurvedic practitioner or a doctor prescribes the appropriate diet for you after doing a proper evaluation, that diet is going to provide you with all the vitamins and all the minerals that you need. Okay, so that's the first thing. Now, the second thing is we get vitamin D from the sun. And so getting enough vitamin D from the sun should be a part of our lifestyle. This is very important in Ayurveda. And so, if you are never spending time outdoors in the sun, with not fully covered, then you're not getting enough vitamin D. It's important to relax. Go take a little time to sit in the sun. You got to stop again. You got to slow down. Take a little time to sit in the sun. Find a place where you're comfortable taking off your shirt and getting sun during the day. And I know we think now, oh, sun's not good for us because it's going to cause cancer. It's going to cause skin cancer. It's all this. You have to get sun. It's about getting the right amount of sun. And your practitioner can talk to you about that. But some sunshine is very important. Every day, some sunshine is important. And in the wintertime, we tend to spend obviously much less time out in the sun, but we still need to get some sun every day. So even if you are bundled up in a jacket, sit outside. Sit outside. Let that sun come in through your face. Let that sun come in through your eyes. So much vitamin D comes from the sun. And when the sun hits your skin, the metabolism of the light is what activates the vitamin D. And this is, very important. So through a proper diet and spending enough time outdoors in the sun, you will get everything that you need. Spending so much time indoors isn't natural. Just like scrolling on your phone is not natural. Spending all your time indoors all day long and not being outside, you're not in rhythm with nature. It's not harmonious. You've got to spend time outside. Go to the park. Go to the park for your walk. So you're getting your exercise. When you're getting your exercise, make sure that you're getting some sun. If it's not too cold, remove layers of clothing. Go in shorts, go in a t-shirt. Get sun on your arms, sun on your legs, sun on your face. Look at what you can do to get some sun.
Okay. In fact, 80% of meetings that I have with Dr. Mark are either in his patio outside or outside a coffee shop. So Dr. Mark is always sitting outside and working. And that's why we do our meeting. So, Dr. Mark, maybe we'll extend 5 more minutes and maybe have short answers. Ruchi is saying, I'm moving to California next month and enrolling in CCA starting January. Are you still involved in daily teaching there?
Yeah, of course, I am still teaching at the college, and I'm not teaching all the classes. There's just simply too many classes. You can't teach everything. So I teach certain classes, and it'll depend upon the semester, and it'll depend upon the level of training that you're in. Right now, I'm teaching the courses on cancer management at the college. Sometimes I'm doing case study reviews with the medical Ayurvedic specialists. Sometimes in December, I'm going to be teaching a psychology class for the principal students that are doing principles of Ayurvedic medicine. I'll be doing their psychology program. There's so many classes at the college, and I'm always involved in teaching. And as you go through the program, it won't be possible for you to get through the program without having classes with me. And then, of course, there's special workshops that I lead in addition to the regular classes at the college. So I do the Yoga Nidra teacher training course, which is a 4-day intensive at the college. And so, you can participate in that. I teach the classical yoga therapy course at the college. You can participate in that. There's so many different classes at the college. So no, I'm not everywhere, but I can tell you the teachers and the faculty that are teaching those classes are amazing. And you will be studying from textbooks that I've written, and I will have interactions with you. Oh, you know what else? With all the students, in fact, we have monthly meetings with all the students, open office hours with me. So with all the principles of Ayurvedic medicine students, they can come online with me or in person once a month, and we spend time together, and we just answer questions, or I bring up a topic and I teach, and we just have time together. I do it also with the clinical Ayurvedic medicine students, different class with them every month. I do it also with the interns. And so, yeah, I'm very, very busy engaged in the classes.
Yeah, Dr. Mark is busy. In fact, when he has time, he's actually changing the curriculum, the notes, and the presentations. It continuously is working on improving our clinical stuff. So, another question, do we do psychotherapy, and are there any psychological counseling that we also do at CCA?
The word psychotherapy is a very specific term used in Western psychology, and follows a specific paradigm that is a part of Western psychology. So no, we don't do psychotherapy in the sense of, Jungian psychotherapy or Freudian psychotherapy. No, students are not trained in that. Students are trained in counseling patients and doing mainly behavioral therapies, and then supporting patients to be able to implement it into their lives. There is a psychological model in Ayurveda that our students do follow. It's unique to Ayurveda, it's unique to yoga. And so students will study in psychology the nature of the mind from a Vedic perspective, an Ayurvedic perspective, which incorporates a yogic Vedantic perspective of the nature of the mind and how it is that we can achieve greater peacefulness. So utilizing those tools and counseling patients according to Vedic philosophy and Vedic psychology, our practitioners are able to support patients to calm the mind, treat anxiety, treat depression, panic attacks, and ultimately calm down the nervous system, work with patients that are experiencing trauma and so many other challenges. So it's a different model, the Vedic model from the Western model, but psychology and counseling is an important part of what we do.
Okay, wonderful. There's multiple people asking post-menopause advice.
Yeah, postmenopause, as we talk about aging and chronic disease, I mean, this is a big part of what women are going to be experiencing later in life. Just as I said before, if a woman has been living her life harmoniously throughout the course of her life, then she'll go through menopause more gracefully. And postmenopausally, if she continues to live a harmonious lifestyle, she won't suffer from the chronic diseases. That said, most women have not lived harmonious lives throughout the course of their lives, diet and lifestyle, go through menopause, have challenges because it's a great transition that's going on hormonally and with age and with ovulation. And so there are going to be significant challenges for most women with hot flashes, with emotional challenges that might happen during and energy challenges that might happen during menopause. And then postmenopausally, the challenges that occur with menopause, with heart disease, and with the challenges in the skin, challenges in dryness in the body, all of these challenges. So Ayurvedic medicine absolutely addresses this. Ayurvedic medicine can work with you postmenopausally to restore to a significant degree, not to being a 20-year-old, but to restore the juiciness of the body, that rasayana that we talked about, path of juice, the rejuvenation. Look, if you're 60, you're not going to be 20. Okay, you're not gonna have that level of youthfulness. However, you can be a very harmonious, loving, beautiful 60-year-old who looks good and feels good for a 60-year-old and doesn't have the chronic diseases and chronic suffering. We do have to accept the aging process in our lives. We go through different stages. As men and women enter the vanaprastha stage of life, which is usually around, postmenopausally after the age of 60, it's a different reality than it is in the grahastha stage of life when you're engaged in the world and you're making everything happen. That's what you're supposed to be doing when you're 30 and 40s and 50s. But when you get into your 60s and 70s, you're not supposed to be doing those things. It's a different way of living. It's a different lifestyle. And it's important that we live that lifestyle in order to remain healthy, in order to remain juicy, in order to remain well. So your Ayurvedic practitioner can certainly work with you on that, with diet, with lifestyle, and with herbal medicine in order to support your body so you're not suffering from those chronic illnesses of age, which includes everything from osteoporosis to heart disease. And you can certainly prevent those challenges and manage those challenges with Ayurveda.
Wonderful. See, when we were designing this webinar, right, on chronic conditions and healthy aging, we were debating whether we should do it one time or we should do it as a monthly series. I mean, there is overwhelming response and questions being asked. So what we will do is we'll probably have a monthly series with Dr. Mark, and there's a lot of questions around mental health and stress. Probably we'll have a webinar on that. There are questions around diabetes, and there are questions about herbs, and even questions on Chamanprash and so on and so forth, right? So what we will do is please email us or reach out to us or set up time to talk to one of our practitioners, but we will continue this series. And maybe at least for the next 6 months, you can expect a webinar every month where I will bring in different practitioners and have them have conversations with Dr. Mark Halpern on different subjects of interest. And if you are particularly interested in us covering a subject in detail, we will actually make a full webinar out of it with some presentation, some knowledge, some diet and lifestyle advice, and then we'll get into the Q&A specific to that topic. What do you think, Dr. Mark?
Yeah, I think that'd be wonderful. I'm happy to participate in that. And I think the webinars are a great way for everybody to come together and to stay focused on health and well-being and the many different facets of that. So yeah, I'm honored to participate.
Yeah. Uncle Ji, I think we are already 10 minutes over. A lot of questions. Sorry, I could not get to everybody's questions, but I hope you got some learning, some knowledge, some understanding to get you started on healthy aging and how to manage if you are already suffering from some chronic diseases. Remember that prevention and promotion of health is more important. At least talk to a practitioner, see what your prakriti is, see if you have any imbalances, and all of us are happy to work with you and take you along. Any closing thoughts, Dr. Mark?
Yeah, just on that topic you just mentioned about, knowing your constitution and knowing what we call your prakriti and your vikriti. Your prakriti is your constitution determined at the moment of conception. It set up all of your tendencies. Your vikriti is your current physiology right now. We need to know both. You will get more out of these webinars if you know your prakriti and you know your vikriti. And then you can ask very specific questions too. And you can say, well, I have a vata imbalance in my heart, or I have a pitta imbalance in my stomach. What can I do? So definitely begin with a consultation with an Ayurvedic practitioner. Really get a thorough evaluation, know what's going on with you, be engaged in a plan with your practitioner, and come to these webinars because they're going to expand your knowledge and they're going to give you new insights into yourself and into what you can do in order to be well. And I look forward to sharing the time with each of you.
Thank you. Over to you, Ankurji.
Yeah, what a pleasure. So much knowledge, information. We're going to turn it into a whole series. We'll keep it going. I've got a little poll up. Let us know if you're interested in a consultation. You didn't even mention the upcoming retreat. Last chance to enroll at the Shivananda Yoga Farm in NorCal. There's going to be an in-person retreat. Dr. Mark with our wonderful faculty is going to be over there as well. Just let us know in the poll if you're interested in that, in a course, in a consultation, and we'll follow up. And hopefully you'll join us next time for one of these webinars. It's always my pleasure to host. Thank you everyone for being here. Dhanyawad.
Thank you all. Namaste.